There are over 30 symptoms associated with the perimenopause and menopause, and this can range from sleeplessness to anxiety, depression, loss of confidence, hot flushes, changes in eating habits, putting on weight, and it generally effectively knocks your self-confidence. And often a lot of these symptoms can be ascribed to other things, so it takes women a long time to realise that this is what they're going through and that therefore they can get support for it. Over the last year, we've been providing a package of support measures to colleagues, both going through the menopause or supporting those who are experiencing it. We've got a dedicated mental health and wellbeing area on our intranet. We've trained 28 menopause champions, this is both men and women, in different teams across the business. All staff have access to a menopause helpline, 365 days a year, and also a Bupa-led menopause plan. So this can provide you with private medical support, early diagnosis and general medical support. We have also developed menopause policy and guidance for our line managers to support people, and all staff within our European region are offered menopause awareness training. So this initiative creates immense social value. If you think about it, there are 13 million women either perimenopausal or menopausal, and about 80% of those women are in the workplace at the moment. Now, it's shocking to think that 1 in 4 women consider leaving their job because of their symptoms, and 1 in 10 do leave their job. So it's an immense risk area for the business. The work that SLR has done on this has been great because we can see the benefits. It's supporting the well-being of all staff. From my point of view, I feel empowered. About 18 months ago, I was struggling, anxiety, difficulty multitasking, tired, I'd lost confidence in what I did. I generally felt washed out and old. And I was worried about going into meetings with male colleagues and they would think I wasn't up to my job. I was encouraged to talk to my colleagues about how I was feeling and my symptoms, and I was so impressed with the response. It was overwhelmingly supportive. All of these men, they say, my wife's going through the same issue at home, so they understood what I was going through, so this really helped me. And that's made me realise that I can now support others as well, so to be more open and have these honest conversations, because it really does help. And I've been working for 29 years in this industry, and I think it's women sort of around my age who are really experienced and highly skilled. And I was considering asking for a reduction in hours and less responsibility. And now I'm in a much better place and I'm taking on more responsibility. I'm really enjoying my job and I'm really looking forward to my career developing with SLR. So I think these initiatives will help retain highly experienced and skilled women in the workplace.